In this video, I will be discussing amyotrophic lateral sclerosis for RADP230. Let's take a look into what this means. Amyotrophic comes from the Greek word meaning without nourishment of muscles, lateral meaning to the side, and sclerosis meaning a hardening of the muscles. Amyotrophic lateral sclerosis in one sentence. This is a progressive neuromuscular disease of the nervous system which affects neurons in the brain and the spinal cord. The cause of this is a loss of muscle function. Let's take a look at the mechanism of injury with ALS. This is the motor cortex within your brain. Motor neurons originate from the motor cortex and run down through the spinal cord to this point here, the anterior horn cell. Here, the upper motor neurons synapse with the lower motor neurons. Neural impulses are carried down the lower motor neurons where they meet the muscle. Here, a muscle contraction occurs with voluntary control. However, with ALS, there is a deterioration of the upper motor neurons and the lower motor neurons. This means that neural impulses cannot carry from the motor cortex down to the spinal cord and there to the muscle. This means that the muscles become atrophied or weakened. The cause of ALS is currently unknown. However, there are a few contributing factors that can affect the risk of developing ALS. One of these factors is genetic. In 5 to 10% of cases, ALS is a hereditary condition. Age can also be a contributing factor, as most causes of ALS are developed between the ages of 40 and 60. It is also more commonly seen in males. Another factor contributing to the development of ALS is lifestyle. Ingestion of toxins such as nicotine through smoking can be another factor. The last factor is environmental factors. Signs and symptoms of amyotrophic lateral sclerosis include an impairment of the gait, as well as a weakness in the feet, ankles, and legs contributing to impaired gait. It also includes low fine motor skills within the hands, speech difficulties and control of the mouth, and muscle cramps within the arms. All of these signs and symptoms are contributed to the low motor control and movement of muscles as a result of ALS. There are two types of ALS. The first type is sporadic amyotrophic lateral sclerosis. This condition occurs in 95% of all cases. The cause of sporadic amyotrophic lateral sclerosis is currently unknown. The second type of ALS is familiar. This occurs within 5 to 10% of cases, and this condition is hereditary. The incidence and prevalence of amyotrophic lateral sclerosis occurs most oftenly between the ages of 40 and 60. This is also the most common neuromuscular disease. With 5 to 10% of cases, this is an inherited condition. About 1,000 Canadians per year are diagnosed with amyotrophic lateral sclerosis. There is currently no cure for amyotrophic lateral sclerosis. This means that it is a fatal condition, resulting in a life expectancy of 2 to 5 years after diagnosis. 4 fast facts about ALS. Involuntary muscles are unaffected because these muscles receive neural impulses from the extrapyramidal motor pathway, which is not affected by ALS. Individuals with ALS also burn calories faster, and this is because they have a lower muscle mass due to atrophied muscles. There is currently no official test for ALS. However, there are common signs and symptoms associated with ALS, making a diagnostic criteria through observation of symptoms. Stephen Hawking was a physicist who lived until the age of 76. This is 50 years after his date of diagnosis, which is quite uncommon, as most individuals only live 2 to 5 years past their diagnosis. Thank you for watching my presentation on amyotrophic lateral sclerosis.